Doctors, what mysterious medical case have you been able to solve? I figured out a way to save the guy's life on the fly. It was a motorcycle accident. The patient came in an agitated state, breathing rapidly, with an "I'm dying" look in his eyes. We intubated him because of his low oxygen levels, but, nothing worked. The tube was still in place, but he now had two massive pneumothoraxes, collapsed lungs, and with each breath, air was escaping through the established drainage tubes. Air was coming in, but not reaching his lungs. There was an airway injury somewhere, and a serious one at that. I told my colleagues in the emergency room to get the bronchoscope ready because we were going to do the fastest CT scan in history and find out what was damaged. Note: a bronchoscope is a small camera at the end of a long, flexible tube. It's like a colonoscope, only smaller, about the thickness of a pencil. He barely survived the CT scan. We made one pass and quickly brought it back to the emergency room to decide what to do next. It was clear from the CT scans that this was the worst-case scenario. The trachea had completely ruptured, and the air injection had created a large air gap in the neck tissue between the two ends of the trachea. With each breath, air was escaping into the chest and drains, but not into the lungs. Basically, he wouldn't have survived the surgery. But if we could push the airway into the lower segment of the trachea, he would be able to breathe again. Catching a moment of insight, I told the respiratory technician to get the bronchoscope ready. I inserted the bronchoscope into the breathing tube, as usual, and asked the emergency room doctor to pull it out almost completely. And there it was. When the endotracheal tube was pulled back, my bronchoscope was in what appeared to me to be a huge cavity of neck tissue, distended from the fact that we had been pumping air in there for a long time. And at the end of this cavity was the other end of the trachea. In fact, this cavity was probably no wider than 15 millimeters, but I got clearly into it and inserted the bronchoscope right in the center into the lower segment of the trachea. Once I got the bronchoscope in, I pushed it as deep into the lung as I could, and the emergency room doctor put a breathing tube on the bronchoscope and pushed it into the right place. We pulled the bronchoscope out and took a few breaths. There was no leak. The chest was rising with each breath. After 45 seconds, his oxygen levels were back to 100%. We got him to the operating room, and about 6 hours later, he was stitched up. The guy survived the night. But the best moment was when a renowned otolaryngologist we had invited to the surgery asked me how I was able to get the tube into the lower part of the trachea. I described the whole process, and all he said was, "How? Nobody does it like that." Edited. Unfortunately, this story doesn't have a fairy tale ending. Without further ado, the neck injury also damaged the carotid arteries on both sides, causing blood clots to form. Over the next few days, these clots broke off and traveled to his brain, causing multiple minor and moderate strokes. He did not become completely incapacitated, but the brain lesions were so significant that he would have been unable to recover. If the patient had woken up, he would likely have remained bedridden for life. The family decided that such a life would not have met an acceptable standard and made the decision to take the boy off life support, making him an organ donor. Although his story ended a few days after this event, his organs have given new life to at least 3 other people. One day, my partner and I went to a call. I was an EMT at the time. That pissed us off right from the start. A young guy in his early 20s woke up with nausea and vomiting. It was a Sunday morning in a neighborhood where young people usually hang out and drink. The call description said that there was blood in the patient's vomit, so the call was upgraded to a team with doctors. We arrived and were met by the patient's girlfriend, who was panicked but escorted us to him. The guy, pale as a sheet covered in sweat, was vomiting almost pure blood into a trash can that was already full of blood. We started examining him and administering aid. His medical history was very vague. He had always had digestive problems, followed a very low-fat diet, suffered from chronic diarrhea, and severe hemorrhoids. We asked him what he had done last night, if he had been to a party. He said he hadn't, that he couldn't drink more than 1 beer, or he would be sick for days. Instead, he smoked some weed, but no more than usual, and from the same batch he smoked before, and he was fine. The vomiting blood was the first time he'd ever vomited blood. Before that, he'd only gone to the emergency room at most because he didn't have insurance. He was obviously bleeding from his upper GI tract, but something clicked in my primitive brain, and I realized what was going on. The dude's liver was literally screaming for help. An inability to digest fats, an intolerance to alcohol, and a seemingly insignificant comment that turned out to be the key to the whole hemorrhoid thing. His One River Live is doctors actoring. If blood flow through the liver is impaired, the pressure in the vessels in and out of it increases. If the pressure becomes too great, the veins in the anus area dilate, forming hemorrhoids. And if this pressure spreads upward, esophageal varices can form, essentially the same as hemorrhoids, but in the throat. They can burst, and then blood can gush out like a wound. Despite our efforts, he lost a lot of blood, and his condition deteriorated rapidly. When he was brought to the emergency room, he splattered blood on one of the walls, lost consciousness, had to be intubated, and had to be transfused, a lot of blood. Later, when the results of the liver tests came back, the head of the department, an arrogant guy who usually didn't get along with either the nurses or us ER doctors, took me aside and asked, "What goes into your training anyway? I can't believe you noticed that." It was a moment I have remembered my entire career, during which I felt like a complete idiot about 90% of the time. Not the mystery of the century, of course, but this story has plagued me for 4 years. I am a dentist, and one of my patients had severe acid erosions on all of his teeth, and especially in one particular spot. I was sure he was constantly chewing something acidic, and only on one side. I literally questioned him at every appointment, and there were tons of appointments because he was literally killing his teeth. Anyway, I was trying to figure out what was causing such severe erosion. Probably 50 times over the years, I asked him if he liked sour candy. He always answered, "Not really." One day, we had a long procedure, and I decided to stupidly list out loud all the sour candies I knew. He sat there with his mouth open, and there was nowhere to go. When I got to SKOU babies, he was like, I love those. They're so sour." He ended up eating 1 to 2 packs a day. Dude, what did you think I meant all this year when I asked you if you like sour candy? I'm not a doctor, but a genetic counselor in pediatric oncology. This is not so much a "what could it be" story as a "trust your intuition" story. An infant came to me with a brain tumor. At first, I was told there was no cancer in the family, but when I talked to the mother, it turned out that she had breast cancer in her early 20s, and her mother died at the same age from a rare sarcoma, and everyone on my mother's side had cancer at a young age. All the standard genetic tests and tumor tests on the child and the mother showed nothing. Usually, in such cases, we just say, "Science still does not know all the causes of cancer, and do not dig further." But the picture in this family was so suspicious that I couldn't just dismiss it. I scheduled a test for a single gene, but on a whole genome sequencing platform, which allows you to look much deeper into a gene than conventional tests. Normally, labs don't sequencing this deep because the probability of finding something there is microscopic. We're talking about an intron, which used to be considered junk DNA because introns don't code for proteins. So, the test finds a mutation deep in an intron of that gene. It explains both the child's tumor and the family history of cancer. Yes, the result is devastating. It's a rare syndrome in which the lifetime risk of virtually any type of cancer is 100%. It's called Lee-Fraumeni syndrome. But I'm glad we finally gave the family an answer, because now we can screen relatives and identify carriers. It will literally save their lives. And of course, it only made me more paranoid. Is a negative result really a negative result? And gave me even more motivation to dig deeper for children with this syndrome. I want to express my gratitude to the doctor who realized my baby girl had leukemia. She had an ear infection and a slight fever. The pediatrician prescribed antibiotics. A week later, we went to hospital because the fever was rising again. As soon as the effects of the paracetamol wore off, the infection was no longer there, but she had developed a lot of bruises in the last weeks. When I asked the pediatrician if I should be concerned, he said, "Oh, sometimes kids just hit things a lot." And the emergency room doctor noticed the bruises on her back and immediately sent us to the emergency room for a general blood test. Now we are 9 months into treatment and everything is going well, thanks to her. My child was born with a rare lung disease, congenital lobar emphysema. At the time, there were less than 50 reported cases in the world. My son was not expected to live longer than 2 weeks. But at the age of 5 months, our pediatrician finally diagnosed him. Our son then had surgery. The upper lobe of his left lung was removed. A year later, our pediatrician was at a major conference with about 700 doctors, and the speaker listed the symptoms of this disorder. Only 3 raised their hand, one of whom was our pediatrician. I'm a medical librarian. A surgeon once called me about a patient she didn't know what to do with. He had a device that needed to be replaced. The problem was its location. If you tried to remove it, he would die from bleeding, and if you left it in, he would die slowly. I did tons of research, even contacted the manufacturer of the device and talked to them. Finally found a tiny lead on the internet that led to a YouTube video with the exact procedure she needed, and she was able to successfully remove the device. I'm not a doctor, I'm a nurse. I had a patient who had been trying to find a medication for anxiety and depression for years. After a couple years of trial and error, we finally found a medication and dosage that worked well for her. Some time passed, and suddenly the symptoms returned. She said, "I don't understand what happened. The medication was working so well, and now I feel just as bad as I did before I started treatment." We had several conversations on the phone and in person, going over everything, looking for the cause. Maybe the pill manufacturer changed. The pills looked different. Did your diet change? Became more stressed? Started moving more? Something else? Finally, I asked if she had recently started a new medication, prescribed by another clinic, and she suddenly remembered. About 6 weeks ago, I started taking metformin. I thought, this is it. I asked, "Pardon me for being blunt, but did you happen to get diarrhea after starting metformin?" She said, "Yes, I'm running to the bathroom several times a day. Everything is coming out of me." I explained to her that because of this, she was not getting enough time to absorb the antidepressants they were just coming out of her system. So, not only was she not getting the effects she wanted, but she was actually starting to experience withdrawal symptoms. She talked to the doctor who had prescribed her metformin, and he switched her to metformin in a prolonged form and changed the timing of both medications. 2 months later, she was feeling good again.